We'll quickly try to look at kidney diseases in general. So, how renal diseases can cause secondary hypertension. We said that secondary hypertension, you're having hypertension because there's an underlying issue. Okay, so you can have an underlying issue of renal diseases. And we're trying to look at the different renal disease that could actually result into secondary hypertension. So what we have is this. You know, you can just pause to look at the picture. This is just trying to look at the action of what renin angiotensin aldosterone system usually comes into play when little blood is reaching the kidney. So kidney is releasing renin and it goes on to become angiotensin II. Okay, just so it increases the constriction of blood vessels, thereby even worsening the condition. So this is what we got. So renal disease can cause secondary hypertension. This is because they disrupt the kidney's ability to regulate blood pressure through fluid balance. Okay, so sorry, I'm coming. So mostly is a renin angiotensin aldosterone system that is complicated in this. You know. So mechanism linking kidney disease is usually for renal parenchymal disease. There's damage to kidney tissue, like all those glomerulonephritis, diabetic nephropathy, polycystic kidney disease. It's reducing the kidney's ability to excrete sodium and water. So normally the volume of blood, sorry, yes, the volume of blood is increasing because things are held back into the body. You can also have renovascular disease where there's narrowing of the renal arteries. It's reducing blood flow to the kidney. So in response, the kidney is what? Releasing the renin angiotensin aldosterone system. This will increase renin and it also leads to vasoconstriction. It will further worsen the condition. Then you can have glomerular disease where there's inflammation of scarring of the glomeruli, so impairs filtration. So there's retention of what? Sodium and water, increasing the blood volume, increasing hypertension. Polycystic kidney disease, we have a lot of cysts, and these cysts are making the kidney not to function normally again. This could lead to hypertension. The chronic kidney disease, of course, the kidney is like gradually losing its function. So this could also lead to complications like that. Okay. So this is just a picture trying to show how, kidney issues could lead to what? Cardiovascular issues and also elevated blood pressures. Okay. Link between them. So clinical features suggesting renal related hypertension is you have a hypertension that you are treating and is resisting treatment. Okay. Sudden onset hypertension. You have hypertension before the age of 30. Okay, malignant hypertension, there's rapid rise in blood pressure just like that, and kidney related signs. Like if you check for creatinine levels, the creatinine levels are actually going high, you know. Then also, uh, if you check the urine, the person is passing out proteins in urine. If you also check, the person is passing out blood in urine, okay. And probably when you check the two sides of the kidney, the size is not the same. That you see the kidney that is fine is doing fine, while the one that is bad is showing that it's bad. So examples of renal condition causing secondary hypertension include diabetic nephropathy, polycystic kidney disease. We actually listed all of them here. Okay. So I think that's what we have. Linking kidney disease or renal diseases to secondary hypertension.